Module Overview. The urinary system, also called the renal system, plays a critical role in homeostasis by filtering blood, eliminating metabolic waste products, maintaining fluid and electrolyte balance, and regulating blood pressure and red blood cell production. It also contributes to acid-base balance and hormonal regulation. This module explores the structure and intricate functions of the urinary system, linking anatomy and physiology to healthcare delivery, diagnosis, and disease prevention. 1. Anatomy of the urinary system. Major organs of the urinary system. 1. Organ 2. Description and function: kidneys. 2. Bean-shaped organs filter blood, regulate fluids, electrolytes, pH, and hormones. Ureters. 2. Narrow tubes that transport urine from kidneys to bladder via peristalsis, urinary bladder hollow, muscular organ for urine storage. Expands as urine collects, urethra tube that expels urine from the bladder to the exterior. Sphincters, circular muscles that control the flow of urine during urination. Anatomical structure of the kidney. Each kidney has cortex, outer layer, contains glomeruli and convoluted tubules. Medulla, inner region with renal pyramids. Urine concentrates here. Renal pelvis, funnel-shaped, collects urine and channels to ureter nephrons, approximately 1 million per kidney. Basic filtration units. Structure of a nephron 1. Part 2nd. Function: Bowman's capsule, surrounds glomerulus, collects filtered fluid. Glomerulus tuft of capillaries. Filters blood plasma. Proximal convoluted tubule, reabsorbs nutrients, water, electrolytes. Loop of Henle, concentrates urine, creates osmotic gradient. Distal convoluted tubule, reabsorbs ions, regulated by hormones, collecting duct final urine concentration, transports to renal pelvis. 2. Physiology of urine formation. Urine formation occurs in 3 major steps. 1. Glomerular filtration. Occurs in the glomerulus: blood pressure, forces water and solutes out of blood into Bowman's capsule. Produces filtrate, approximately 180 litres per day, which includes water, ions, glucose, amino acids, RBCs, and proteins, remain in blood due to size 2. Tubular reabsorption filtrate moves through proximal tubules. Essential substances, glucose, sodium, potassium, water, are reabsorbed into the blood. Occurs via active transport and osmosis. 3. Tubular secretion. Additional wastes, e.g. hydrogen ions, creatinine, drugs, are secreted from blood into tubules, helps maintain acid-base balance and detoxifies blood. Final product: urine, composed of 95% water, 5% solutes, urea, creatinine, uric acid, electrolytes. Daily output: 1.5 to 2 litres. 3. Hormonal control of renal function. Key hormones involved. First, hormone. Second, function: antidiuretic hormone, ADH, promotes water reabsorption in collecting ducts. Aldosterone enhances sodium and water reabsorption in distal tubules. Renin-angiotensin-aldosterone system, RAAS, increases BP via vasoconstriction and aldosterone release. Atrial natriuretic peptide, ANP, reduces sodium and water retention. Lowers BP erythropoietin, EPO. Stimulates red blood cell production in bone marrow. Calcitriol, active vitamin D, regulates calcium and phosphate balance. 4. Fluid, electrolyte, and acid-base balance. The kidneys regulate fluid balance by adjusting water reabsorption, electrolyte balance, sodium plus, potassium plus, calcium 2 plus, chloride minus, bicarbonate minus. Acid-base balance by excreting H plus and reabsorbing bicarbonate. This is essential to prevent disorders like hyponatremia, low sodium, hyperkalemia, high potassium, metabolic acidosis or alkalosis. 5. Common urinary disorders. 1. Disorder 2. Description 3. Symptoms: urinary tract infection, UTI, infection in urethra, bladder or kidneys, dysuria, urgency, fever, glomerulonephritis, inflammation of glomeruli, proteinuria, hematuria, edema, renal failure, AKI, CKD, loss of kidney function, oliguria, uremia, electrolyte imbalance, kidney stones, nephrolithiasis, solid crystal deposits, severe flank pain, hematuria, polycystic kidney disease, genetic, fluid-filled cysts, hypertension, kidney enlargement, incontinence, inability to control urination leakage, urgency, benign prostatic hyperplasia, BPH, prostate enlargement affects urination, weak stream, retention, enuresis, bedwetting in children, nocturnal involuntary urination. 6. Diagnostic tests and interventions. Urine tests, urinalysis, checks pH, protein, glucose, ketones, RBCS/WBCS, 24-hour urine collection, measures creatinine clearance, urine culture, detects infection-causing organisms, dipstick test, rapid screening, blood tests, serum creatinine and BUN, assess kidney function eGFR, estimated, glomerular filtration rate, measures kidney filtration capacity, electrolyte panel, detects imbalances imaging and other tests, ultrasound, visualizes kidney structure, CT scan or MRI, detailed views of stones, tumours, cystoscopy, endoscopic view of bladder, voiding cystorthrogram, checks bladder emptying. 7. Therapies, nursing care and health promotion. Treatment options, antibiotics. For UT is dialysis, hemodialysis or peritoneal. For kidney failure, lithotripsy. For kidney stones, surgical interventions, e.g. nephrectomy, catheterization, bladder training and pelvic exercises. For incontinence, nursing and community interventions, fluid intake promotion, hygiene and perineal care, monitoring intake, output, I and O, patient education on UTI prevention, dietary sodium and potassium control,